All right, we are live. Second half of Life Unrehearsed. Dr. Mark Sherman, one of Montreal's finest endocrinologists, going to talking to us about diabetes and a bunch of other fun stuff. It should be very, very educational. Hope you enjoy.
Looking forward to it.
Yeah, so are we. It's been a while. Corey, we've wanted to tackle diabetes for so long.
I think we do ask a question about the increase.
Yeah, are diabetes rates increasing or decreasing? It almost seems epidemic.
Maybe not.
So, yeah, you won't be able to hear the song, but it's
he
that
saw.
for
He saw.
Instagram.
There's actually two songs.
Couldn't do sugar, huh?
No.
Yeah, I wanted to rough it up a bit, get a little rock.
Okay, I'm good with that.
Showman guy.
Oh, yeah?
He's a Showman TSN 690 guy. That's good.
A little bit of everything.
Yeah, everything in moderation.
Everything in moderation. There you go.
We're going to hear that.
Killed my half hour.
So it could boil down to one sentence. Everything.
Well, that's part.
Here we go. Welcome back to Life Unrehearsed. Matt Delvecchio here, specializing in free retirement home search and senior transition support, in studio with Corey Sirota, clinical social worker and psychotherapist specializing in grief and loss. It's always fun with Jamie Benezeri, rapid fire Q&A.
Here's the problem. Right after he left, he's sitting there, he's talking to me about Instagram, and I'm like, Instagram, I have no idea what you're talking about. I don't know what to do. I'm technologically challenged.
Corey, we have help for you.
Really?
In fact, just yesterday, this was brought to my attention, and I think this is just incredible. This is a free session. It's called Teenagers and Technology. It's brought to the public by Quality Family Home Care in partnership with Customized Home Care. Andrew DeFore, the owner of Customized Home Care, great guy. New Horizons for Seniors Program, Ruth Peltier. Anyhow, they are matching up volunteer students in high schools to teach seniors about technology. And it's free. I think it's fascinating to have these workshops.
Are you saying I'm a senior?
It goes to show, you don't even have to be a senior if you're
totally
illiterate. Okay. So they're going around over the next couple of weeks. Rosemount High School, Technology Center, Royal West Academy and Royal Vale School, Laurier Mac, John F. Kennedy over the next few weeks. I'm going to give you a number. If you're interested in learning about technology from those that use it the most, the teenagers, call Ruth Peltier. She can be reached at 450-455-5982, and it's a free service.
Fantastic. I am going to, we should post it. We'll post it on our Life Unrehearsed.
That's a very good idea. We'll do that after the show.
In case anybody wants to know. So that's great and very, very useful service. So I am very, very thrilled to have in studio today Dr. Mark Sherman. Because, as we spoke about a little earlier, there are 11 million Canadians living with diabetes or pre-diabetes. And every 3 minutes, another Canadian is diagnosed, which is astronomical when you think about it. It's estimated that over 20% of diabetes cases actually even go undiagnosed, if that's adding insult to injury. So there's a very good chance that you know someone, or it affects you or someone else that you know. And which is, again, why we're so happy and delighted to have Dr. Sherman, a leading endocrinologist at McGill University Health Centre since 1993. He's also the director of the Lipid Clinic since 1993, as well as the director of the Metabolic Health Centre at the MUHC since 2008. On top of that, he was the chair of the McGill and MUHC Division of Endocrinology from 2012 to 2016. And I know that his accolades could go on much longer, but we want to hear from him. So welcome to the show, Dr. Sherman.
Thank you for having me.
So in order for us to all start on the same page, I'm going to ask a very simple question. What is diabetes?
So diabetes is when your body doesn't use sugar the way it's supposed to. Sugar is our fuel, our energy. It's like gas in a car. And normally we have a very good system where the sugar comes in through what we eat. We break down some parts from our muscles when we need it, and we process it, burn it, and use it as fuel. In diabetes, some of that doesn't work properly. Either we don't produce enough insulin to help the sugar go where it's supposed to, or we fight the action of our own insulin because of body weight or the wrong foods.
And further to that, I hear a lot about type 1 and type 2. Don't know the difference, so can you please define that for us?
Sure. Type 1 diabetes is when someone doesn't make enough insulin, usually because the pancreas has stopped producing. Most commonly it occurs in children, but sometimes it does occur in adults and older people. Whereas type 2 is where the body resists the action, and even though we produce lots of insulin, it just doesn't get the job done. And mostly that occurs in people over 30 or 40, but we are seeing more and more people in their teenage years and adolescence who are developing this problem as well.
Well, it's scary. The numbers are very, very scary, and it sounds to me like, based on some of the stats, we were saying that the rates are in fact increasing,
Yes.
almost to the point that it seems like somewhat of an epidemic. So I want to ask, what's the major causes of this?
Well, diabetes is tough to pin down to one cause. We'll focus maybe on type 2 diabetes because that's the one that's growing, and it tends to follow the patterns of body weight gain, obesity, inactivity. Excuse me. But there is a strong genetic component as well. There are certain ethnic groups like Native Canadians, First Nations, Mexican Americans, and others that have a higher chance of developing diabetes, even given all the other same circumstances.
That's Dr. Mark Sherman, the leading endocrinologist right here in Montreal on Life Unrehearsed, talking to us about a disease that does affect a lot of people and family members. My stepdad has diabetes, and I know it can affect him drastically. He's constantly monitoring it, and it just doesn't affect him, but it affects the family as well. My mom is always worried and,
Right.
and wanting to make sure he's okay. And you think you're okay, and I guess once you surpass a certain point, then you really got to be careful. So I would like to hear from you, Dr. Sherman. Let's start with some prevention tips. What could you give
Sure.
as advice for people?
So I think the most common things are to let common sense dictate. If you had to sit across the table from me and say I was a diabetic, what to do, you'd have a common sense approach. You'd say I should be more physically active, I should be eating carefully. There's no one particular food to eat or to avoid, one supplement to take or to ignore, but it's really a global approach, common sense, moderation of everything. There's not even any foods that absolutely have to be ignored. It's just that, for example, a dessert, you can have a dessert. You have to have a dessert once in a while. It can't be an everyday occurrence. Exercise should be regular. It doesn't have to be Taibo, kickboxing, or anything. It should be anything. Flight of stairs, walk around the block, put on a step counter, use your smartphone. All these things are ways to just get yourself moving and get yourself inside and outside into better condition.
So you make it sound so simple, and I think what was really striking to me is anything I've ever heard about diabetes was always connected to less sugar intake, and you need to stay away from X, Y, and Z. That's a myth. There's a lot of other myths that we're hearing. So can I ask you about things like blindness? Does diabetes lead to blindness?
So if you would have asked me this question 30 or 40 years ago, I'd say it was a very common problem. And it still can, in rare cases, cause someone to develop blindness. But we're very, very proactive about people screening themselves. See an eye doctor. You can't count on not being able to read the fine print to know if there's a little bit of diabetes in the eyes, because if it does touch the eyes very early, it can be reversed with laser treatment. Sometimes other treatments can be invoked as well. But even in these situations, blindness can be prevented. So we very rarely see someone go on to blindness with diabetes these days.
And Dr. Sherman, how about going along the theme of myths? Foot care is also very important, but I've heard cases of foot amputations. Of how extreme can it get to that level?
So again, less and less. The key for that is education, vigilance. If someone has the 2 minutes once or twice a week to literally look at the bottom of their feet, they can usually prevent a problem. Because most foot amputations start with someone who doesn't feel their feet properly and doesn't realize they have some kind of small cut, a little bit of an infection, and they keep walking on it, wearing shoes with it, and introducing bacteria that can then go on to cause a problem that doesn't heal. Most people will never get that problem. Most people will be able to heal their wounds well, and if they even take the time, which is very brief, once or twice a week, they'll see things as the first sign, and they'll be able to prevent any progression. And you clean it, you cover it, you put a little antibiotic ointment, it'll get better.
So common sense, again, common sense prevails. So what about one more myth? What about someone who has diabetes? Do they need to take medication all their life?
So most people will need something somewhere along the way. There are a great number of people with diabetes, when they catch it early and take the common sense approach, they're able to not need medications. Unfortunately, most people at some point will need some kind of medication, and unless they really turn it around, chances are they'll need to stay on that medication for the long term.
Very interesting. Dr. Mark Sherman talking to us about diabetes. We're going to head to a traffic update, but when we come back, it's amazing, Corey, to hear about some of the technology, even some apps that are out there that will help for diabetes care, and we're going to hear all about that once we head out to the CJD Traffic Center with Lauren Glazer.
Perfect.
Good stuff.
Oh, you saw. I wanted to skip there.
Yeah.
Because now we go to prevention. You started.
Sure.
We're gonna go then treatments, team approach, like all that
So I
other
touched
stuff.
on the walking stuff and the step count. I'm going to bring it back with the
Sure,
apps
sure.
because that's an important
But
thing.
that's
too.
great.
Yeah.
And also, there was a funny story apparently.
Oh yeah, you gotta kick me into that.
Okay.
Yeah, that's the funny story with the one we had talked about.
Yeah.
See how fast it goes. You're great. You're great. You're great.
Oh
you're
yeah,
great.
totally natural.
Yeah.
Should we do ass on the radio or no?
That's fine. Yeah. No,
Oh, you're doing fantastic,
Yeah,
and
yeah.
it's very interesting too.
Yeah.
What's the shock? I have two questions. The shock, because my stepdad had a couple of these. Is it anaphylactic? Not anaphylactic shock. When you
hypoglycemia,
is
low
that what
blood
it?
sugar.
Pardon?
So low blood sugar.
When you go really low and then he's just a zombie.
Yes.
So what's that called?
Hypoglycemia.
Hypoglycemia.
Low
Yeah.
blood sugar.
Right.
I
You're
don't know.
asking that.
Hypoglycemia.
GLY.
Okay. It may or may not come up.
Yeah.
When we're, Corey, just for you,
Yeah.
prevention tips. He's already talked about
Right.
prevention tips, but there's a secondary prevention tips for those who have
Okay.
complications. They have diabetes and they're having some complications, and you had
Okay.
mentioned there's some prevention
Okay.
tips for
I see.
those that are
I'll do
experiencing
that.
complications. You okay with that?
Yeah.
Yeah, we talked about things like cholesterol and blood
Yeah,
pressure
yeah.
reduction.
Yeah. Okay, so I wanted you, Corey, to know because that might
You
be
want me to ask
confusing.
that?
So prevention tips for
I'm gonna
those
say
that
I
have
highlighted
complications.
it. Yeah. Okay.
And then the funny story and the team approach to diabetes. So first one will be the app.
Okay.
Second one, Corey,
Yeah. Those experiencing.
experiencing diabetes, complications, and prevention tips. And then we'll get into the funny story.
Okay.
And if
And
we
then
have
we'll
time,
keep going. Team approach.
team approach.
Sure.
Anything.
Would you, to weigh the importance, the team approach versus complications for those that are experiencing diabetes, which one would be more important?
I think the team approach.
Okay.
Okay.
People
So
need
should I
to
not
know.
do that?
No, go to
Go
team
to
approach.
the team approach. So that's going to be my question.
That's going to be your question. If we have time after funny story, then Corey, you'll ask that
Yeah.
the complication one.
Yeah.
Okay.
Just want to make sure. Doing good on Facebook?
Still here?
Still here.
Awesome.
And I won't take too long. Like you'll make the comment at you're welcoming back, right?
Mhm.
You'll say that was from the Stars Born. Yeah. And you want me to say something about having seen it?
Having
You're
seen.
gonna ask Stars Born.
Oh, I'll start with the Star is Born.
Yeah, but
Yeah.
it won't be a long
Yeah,
discussion.
yeah, that's true. What'd you think of it?
Yeah.
Yeah.
So we'll do apps question. We'll do team approach. We'll do funny story. And then if we have time, complication. Prevention tips. So at around 4:55 and a half is when we're going to thank you, and then what would you suggest for diabetes care?
Yep. Where they can get more information.
Yeah.
Right. It flew by. It just it normally flies by, but I'm finding this one.
Yeah, this one
It really is.
Actually, but you gave a lot of good information.
Many people find their memory changes as they age. GCP research is conducting a
My mom lives in Oakville. Actually, she just texted just before the show, not knowing we're talking
Oh, is that right?
diabetes, so I'm sure she's glued to to the radio. Or maybe she's glued to Facebook Live. You listening, Ma? Joe, listen up! Welcome back. You're listening to Life Unrehearsed. Matt Del Vecchio here with Corey Sirota, and we're talking diabetes with leading endocrinologist Dr. Mark Sherman. Very interesting. Corey, just before we start, you know, that song was a Bradley Cooper song from the movie A Star is Born, Maybe It's Time.
Yeah.
I didn't even know the guy could sing, and I heard you saw the movie.
I did. It was a nice movie. I mean, I have to tell you, I'm a big Barbra Streisand fan. So for me, it's nice and good, and it's interesting to see, and you know, beautiful songs. I'd say I have to go with my favorite was Streisand and Christopherson.
You're going with Barbara. I hear you.
You haven't seen it yet?
No, I haven't seen it. We're supposed to go next week, as a matter of fact.
Enjoy?
Yeah, looking forward to it. All right, just before traffic, we talked about some amazing apps and how technology is developing. So, Dr. Sherman, you see it. You're doing a lot of research. Anything that stands out to you with some technology?
So I think the best thing about any of the technology stuff is it really empowers the person with diabetes or who's trying to prevent diabetes to take better control over their own situation. It's one thing for a doctor to say, do this, do that. It's another to have an exercise tracker or a blood sugar monitor that you can look at your smartphone and see patterns and trends, a step counter, something that sends you a reminder to check your blood sugar, something that can even notify someone you want to know or someone in your family if you get a low blood sugar or something like that. There are apps or there are Bluetooth things that connect to some of the continuous sugar measuring devices that can actually signal someone else if you get into a crisis, which is really very important. It's not something we use a lot, but there are some people who really depend on this sort of thing, and it can be really a game changer for them.
I think it's great. I think it's amazing that it can be so helpful. I know that also, and it just speaks to how progressive we have become in terms of helping people who experience diabetes. So also I understand that you talk about a team approach in effective diabetes care. Can you comment on that?
So I think there's two ways to look at the team. There's the team on the side of the healthcare providers, including the doctor. There could be a nutritionist or dietitian, a diabetes educator. The family doctor has a role to play, and some family physicians have dietitians in-house. But there's another side of the team approach, and that is the family. It's very difficult for one person to eat a certain way while everyone else in the house is doing differently. And the other thing is sometimes an exercise buddy can be a good thing, because people tend to get into a hole at some point with exercise, but if you feel like you're letting the other person down, then you'll bring them up and they'll bring you up, and you're more likely to continue something like exercise for your own health.
Makes perfect sense. That's endocrinologist Dr. Mark Sherman here on Life Unrehearsed, educating us about proper diabetes care. Some great tips, Dr. Sherman. You see a lot of patients. You're at the Glen, MUHC, and other practice as well.
Yep.
And you talk about team approach, but at the end of the day, it's up to the individual.
100%.
And you've got a funny story with some of your patients. Can you recount just one of them?
So the most recent interesting story was a lady with pre-diabetes. So in that situation, she's not actually diabetic, but her sugars aren't normal either. So I've been pushing her, and she's accepted the mission to improve her health. So she came back to me having lost a significant amount of weight, improved her blood pressure, her cholesterol, and her sugar, and I congratulated her. And she says, "No, I don't want you to congratulate me. I want you to kick my ass. I want you to tell me again how much harder I have to work." So that was actually very encouraging to me, and very rewarding as well.
That is great. That's
get mad at me. Get madder.
That's right.
Yeah, well, that's it. And they're looking for you for the validation, I suppose. There was something else we spoke about earlier. We talked about prevention tips, but that was prevention perhaps of somebody, if possible, who does not have diabetes.
Right.
What about prevention for those who might be experiencing complications with diabetes?
Okay, so that's a little more challenging, because there you really have to get involved with more things. So you talk about making sure you see an eye doctor regularly, making sure you're taking care of your feet. Don't go barefoot. Check your feet. Wash your feet well. Dry them well. Making sure your blood cholesterol and blood pressure is within the target ranges can prevent complications, but it can also prevent existing, when you started with something, to advance to a more serious situation. So we really emphasize all of those things: education, education.
Yeah, and listening to Life Unrehearsed. One more quick question while we have you. Hypoglycemia.
Hypoglycemia.
If I said that right,
You did very well. Yeah.
It's a phrase that a lot of us hear. I know I've seen it firsthand. Can you explain what that is, and can we do anything to prevent it?
Right. So hypoglycemia is when the blood sugar goes below the normal level. Normally we have a very tight range. In diabetes we sometimes see it go high, but certain treatments for diabetes like insulin and certain pills can actually make the sugar go below normal. So we're always shooting for as normal as possible. Sometimes we overshoot. How do we prevent it? Well, a lot of the newer medications are allowing us not to use insulin, and also they themselves don't cause low blood sugar. If someone is going to do exercise and they've already taken some insulin, we ask them to eat a little bit extra or monitor their sugar a little more frequently so they can find themselves on the way to getting low, not allowing themselves fully to get low. If they do get low, a little bit of sugar, a soft drink, milk, juice. It's one of the times we tell people they can have a soft drink is to correct the low sugar and then to take protein to keep it up for the rest of the time.
And from what I understand, juice or something like that, rather than a candy, because it can get into the system quicker, is that right?
Well, one candy is not usually enough, and if your mouth is a little dry because you're already low, you might not be able to, manage a candy.
Go for a quick OJ or juice or soft drink.
Yes.
Good.
Okay, that's terrific. Well, I cannot thank you enough. There was a ton of information in such a short period of time. How can people get more information?
So there's a lot of ways. I mean, if they go beyond their family physician, they can look at the Diabetes Canada website. There's a wealth of information. There's the Association Diabète Québec, ADQ, as well. So that's going to be in both official languages, as is Diabetes Canada. And, of course, their family doctor. And be careful what you read on the internet.
Good, wise words, for sure.
Dr. Mark Sherman from the Glen talking to us about diabetes. Thank you very much.
Thank you for having me.
Corey, what do we have on the first half? For next week
Next week. We're already done. Next week on Life Unrehearsed, we are going to be talking with presentation coach Susanna Baum. What speaks louder, your words or your body language?
Yeah, Susanna is excellent talking about public speaking. And we will also have in studio with us, we're going to be getting some expert financial advice from Marco Vendramini next week. That's on Life Unrehearsed, where you can catch us every Sunday at 4 p.m. Thanks for joining us. Good.
Okay,
So,
great. Thank you.
thank you, and very good. Yeah, I got to stop Facebook. Thank you very much. We'll say goodbye.
Bye.